delay here. We had some technical difficulties, and also I was just receiving a lot of information about Rockland County, and today we're going to go over that information because it's definitely becoming more of a concern as far as dealing with the number of cases and how the county itself can handle the situation. So we're going to go over a couple of things today that are very important regarding the coronavirus, and then open up for Q&A. Some big topics we'll cover is definitely about Rockland County and what should the response look like, and then we're going to go over some congressional action, like some of the several stimulus bills or packages that were passed, and a way forward. Because I think, when you look at this situation, we have to look at not only short term, and I would say that our government right now is being very reactive on how we are responding to the coronavirus, but we also have to look at it and how this is going to affect us long term. So, if you have just joined us, please hit the thumbs up as well as share it with everyone. We are with Afternoons with Asha, and again, I'm a congressional candidate for Congressional District 17, and it is not only my responsibility to make sure that I provide you with the most updated information, but also provide information to you that I feel that we should be doing moving forward as we respond to the coronavirus. So again, join us, come on in and hit the thumbs up and share it with everyone. Okay, so before we start, I want to again give a moment of silence to those fallen soldiers, those people that have passed away from the coronavirus, and those that our family or friends that have just been impacted. And it's really unfortunate where we're seeing day after day more and more people are just passing away from this awful, deadly virus. So let's give us a moment of silence. All right. Okay, so United States is right now experiencing a terrible pandemic, and again, uh, Westchester County as well as New York City is the epicenter of this crisis, and it's very unfortunate that we are continuously experiencing this pandemic as we're watching the number of cases go up. We have, the healthcare system, especially our healthcare workers, that are just overwhelmed with not only what they're seeing in person as far as the number of people that have passed that are impacted by the coronavirus, but also overwhelmed with resources. So I definitely want to just give a shout out to those frontliners that are out there, not only just the healthcare workers, but also you have police officers, construction workers, you have correctional officers, you have cashiers out there in stores. You have so many people out there fighting against this virus, and it's not easy. They're taking out their time to risk their health to make sure that we live with stability in our community. In fact, I would tell you the other day, I actually visited the Westchester Community Center, and just watched, the construction workers, the Army Corps of Engineers, um, build up the site, and the site is coming along. They rapidly build up the tents. They're moving in resources and important equipment that is needed to actually have a setup of a hospital site. So I definitely want to give a shout out to them, that thank you so much for being out there to work hard and make sure that we have this hospital site set up. Uh, it is unfortunate, though, that there may be a possibility that we may reach that apex of more than 50% of New Yorkers or people in this state itself will be impacted by the virus. We want to avoid that, like Governor Cuomo says, but we also have to be prepared. Now, looking into the situation in Rockland, again, Rockland is unfortunately being impacted significantly. And we just heard a lot of reports coming from the county executive that they need more resources, they need more support out there. And in fact, they brought up that there's a that a recommendation that what you're seeing in New Rochelle, that they want a containment site and a containment zone, which you're seeing in New Rochelle, like, providing humanitarian support, especially to the folks in those areas. So I agree. I recommend that we should have a containment site in Rockland County, especially if the number of cases are dramatically increasing. We need more resources out there to help fight against the coronavirus. And in fact, if I was your elected official right now representing Rockland County, I would ensure on the federal level that that Rockland County receives the necessary resources to set up that containment site. And this is why I called on for not only that the executive office should support the Defense Production Act, which is bringing more ventilators and PPE produced by the civilian industry like General Motors, but also we should make sure that there's a good command and control going on in terms of the number of personnel to support these containment sites. So unfortunately, since the National Guard has been involved in the coronavirus, we're seeing a number of frontliners like them being impacted by the coronavirus. So what does that mean? We are experiencing a shortage of personnel, and especially when it comes to uniform folks. So this is why I said, on a federal level, if I was your congressional representative right now, I would be pressuring the executive office to activate the reserve and active duty component to support these containment sites, support the National Guard. There's a big call for duty right now, especially among those that are in the IR or the retiree community, to come back in and help us support with this virus. So that is evidently a sign that we are short in personnel. So in order to make sure that we're fully prepared and equipped to take on a virus that continues to spread, we need to make sure that we plus up in uniformed personnel. And a way to do that is to definitely call on the executive office to activate the reserve component as well as the active duty component to support these local missions that National Guard is right now the primary lead in. So this is very important, with the fact that when it comes to movement and how rapidly it happens, we have to make sure that we rapidly deploy these people, these personnel in these areas, so that there's no hiccups when it comes to movement, and we can have an established quick response when it comes to providing the necessary personnel. So again, I support the idea that the recommendation that we should have a containment area, but on the federal level, we need to make sure that there's enough resources, personnel that is being trickled down to areas like Rockland County so they can establish the containment zones. So another thing too that's very important when you're looking at this command and control situation as well as responding to this virus is that we have to look at it long term. What you're seeing right now, because from federal all the way down to local, we were not fully prepared for this. And in fact, there's a lot of signs of that going back to January. So with that being said, we're right now in the phase of being reactionary to everything, right? Making sure that we have equipment in place, the personnel in place, making sure that we're looking out for our healthcare workers. I mean, there's just an array of issues that we're managing here. So with that being said, because we're so reactionary, we have to look long term on how this is going to work when it comes to control, responding to the coronavirus. So even if we're beyond the point that this crisis is over, what does the recovery look like? What does recovery look like? Especially when it comes to paying for it. We're seeing that a series of stimulus packages are being passed in the federal government, and I think that's great. But we also have to look at our numbers on how we can really realistically support the people and not overwhelm the system. And the only way to do that is if we have a long-term plan on how we respond to this crisis. So now that we have talked about Rockland County, I want to now move on to our congressional action that we're seeing right now. Um, Again, we have a lot of frontliners in place that are out there helping to protect our people, our communities. And when we look at the healthcare workers that are out there that are working in those hospitals day and night, I want to definitely, tell them thank you so much because they are going through a lot. And in fact, because they're running out of resources rapidly, and we're having there's an issue with flow of resources overall. If I was your elected official right now, again, I would definitely continuously pressure the executive office to support the Defense Production Act, and we're seeing that right now. The executive office did pass the Defense Production Act, and again, I think they're going to do it one more time because of the amount of resources that are running out, like masks and ventilators, or what we call PPE. So that's very important to underscore that that's continuously happening. It just doesn't happen once, but it happens over and over again until the point that we have actually effectively counter the crisis. Another thing too that we've seen coming out of Congress that I would definitely support if I was elected official is to support the Coronavirus Preparedness and Response Act, which helps to support small business owners or small businesses in the local area. This has definitely been a major concern because we have so many small businesses in the district and also countrywide. So many of them are forced to stay home, quarantined until April 30th. So in the meantime, we have to make sure that these businesses do not die out. So this is a good sign that the federal government is actually issuing grants or loans to help make sure that they survive. I think this is something that we need to continuously do. Um, Again, though, we have to make sure that we look at this issue long term. Also, what we're seeing coming out of the crisis is, out of the Congress, is the Families First Coronavirus Response Act, and also called the Coronavirus Aid, Relief, and Economic Security Act, which is also known as CARES, which was passed March 27th. The CARES Act is very interesting. It covers a lot of areas that helps to achieve economic security. And we're going to go through each one, but I would say for the most part, there's some critiques. It's not perfect. And I will definitely let you know what some of the recommendations that I would fix looking at the different type of indicators we have here. So number one, we have for under the CARES Act $200 billion for hospitals, healthcare workers, and health research. I think that's adequate. But again, we have to look at this long term. Will we have to continuously give them issue or appropriate more money if the crisis continues, to persist? We'll see. But $200 billion for hospitals, healthcare workers, and health research. Also, we have an immediate direct cash payments to lower and middle income Americans of $1,200 for each adult and $500 for each child. In many ways, that's a good sign because, again, we are seeing that we do need money. We're forced to stay home and not work, especially if you don't have paid leave or, you have a small business and once you close down shop, you no longer receive money. But when you look at the economic conditions in this district, especially if you're going to look at this and say, hey, this will help pay all your costs, your housing costs, or your bills. Again, this is not enough, especially in places like Westchester County or Rockland County. But it is a good sign that they have issued direct cash payments. But in Westchester County or Rockland County or in this district or in the 17th district, it's not enough. But we'll talk more about that moving forward. Then we also have expanded unemployment benefits up to an additional $600 per week, while expanding expanding to workers in gig economy and self-employed workers. Okay, so that's good, especially for the fact that we are forced to be at home and can no longer, cannot work from home. Some can, but some can't. Also, we have more than $375 billion in small business relief. very good. And then we also have a 4-month postpone on evictions for tenants living in federal assisted housing or in a property with a federally backed mortgage. Okay, so I think that the eviction coverage here is good. So that's saying, hey, that if for the next 120 days, if you cannot afford to pay for your rent or your mortgage, you should not be evicted. I think that's good. I think that's good coverage. But I think a more of effective approach is actually canceling rent or mortgage payments. I think that's more easier to control, easier to manage, because I will tell you, watching around and listening to many people in our district and countrywide, there are some rental property owners that will try to find a way to take advantage of you by saying, hey, I want my money now, and if not, you're out of here. Despite that, the federal government is mandating that, hey, leave these people alone, do not evict them. And that's good intent, but we have to be able to effectively provide legal protection for these people that are already being taken advantage by rental property owners saying, hey, I want my money now regardless of what is being issued. It's right now considered illegal, but we need, again, better legal protection. Another key indicator that is that's part of the stimulus package is that there's deferrals on federal student loan payments. I would say that we should definitely do that, but without interest. No interest should be involved in those student loan repayment plans. Again, it should be canceled, but no student loan interest. So I think that's a good sign. And in fact, once this period is over, the federal government should make sure that do not lump all 4 months or 5 months of those payments and say, hey, pay me in September or October, plus pay me for additional payment. That's not how that should go down. We should make sure that these payments are completely canceled during a crisis like this. No one asked for a crisis to impact us and reduce the quality of living. So in the meantime, we should make sure that once this crisis is over and during the recovery period, that we should not be asked to pay all that money that has been deferred. So I just want to make that clear. The whole point of this is that we want to make sure that Americans are not overwhelmed as a result of the coronavirus, that we achieve financial stability, that we do not exacerbate wealth inequality, and that the recovery is pretty much smooth. And we are already watching, the Dow Jones drop to where our 401ks, our retirement accounts, are shrinking as a result of this. I mean, Dow Jones goes up and down, but it's significantly dropped. So many of us have lost money from this. There's a possibility that, we can go into a really deep recession as a result of the coronavirus. So it is so important that our federal government, state and local, are very realistic when it comes to recommending some of these recommendations when it comes to these stimulus packages, especially on the federal level, because we want to make sure we do not create a financial crisis and that Americans are protected and that they are experiencing some sort of financial stability when they're experiencing fighting against a coronavirus. Health security right now is priority. You do not want to overwhelm people when it comes to paying their bills while they're fighting a virus. So it is a moral responsibility that we make sure that we have a system in place to ensure that our bills are covered and that we are fighting this collectively and that we're being very realistic to everyone on the local level. We can provide as many recommendations as we want in government and saying, hey, you're getting this amount of money, but we have to make sure that we're realistic at the end of the day. Um, Also, that I wanted to include that there were some packages that were also that cover some key issues as far as New York State. If you look at these packages, they include much needed assistance. So not only the federal government is passing some stimulus packages, but also we're seeing in the New York level, they're also passed some key packages that are very important. Like for instance, $15.5 billion in direct cash payments to New Yorkers. We also have $15 billion in unemployment insurance benefits. We also have $7.5 billion into state and local government coronavirus relief funds, including $1.4 billion for New York City, billions for New York hospitals for equipment, supplies, staffing, construction. We also have 45 million not only to New York City but also to New York State when it comes to law enforcement agencies for response to this outbreak, including purchases of PPE. And we have billions going towards small business administration for forgiveness loans and grants to New York's 2.2 million in small businesses, including religious affiliated entities. And then we also have a 15 million for senior nutrition programs to provide home delivered and prepackaged meals to low income seniors in New York. By the way, if you come across any local project, food pantry, um, just nonprofits that are out there aggressively providing, um, humanitarian assistance, especially to the elderly, please help them. Please provide donations. We really need to support them, especially for those that are elderly and they do not live in nursing homes and they're home by themselves. They're really feeling like they're the most vulnerable, and they are, and they need a lot of assistance. So this is a really good sign. And again, you can always find some local contacts or projects that are going on right now to help those people. We have also 192 million in emergency solution grants to help families and individuals who are experiencing homelessness during the pandemic. Excellent recommendation. We're definitely seeing that as a problem for low-income families as well as the veterans community, where prior to the virus they were experiencing homelessness, and now the virus has exacerbated those conditions. So we have to make sure that those people out there that don't have homes to be quarantined in, that we get them inside area to provide housing for them, so we can work with them and help protect them from being impacted from the virus. So with that being said, I think moving forward, it's common sense that not only in the federal level but also in state and local, that we continue to support stimulus packages that cover, our not only our health security but also help make sure that we achieve economic stability as we're going through this virus. But I again call for that we should make sure we look at this situation long term. Um, it's definitely a unique national security threat. It's something that most of us did not expect. But again, we have to come together as a country, regardless of who we are, and really think through this hard. And I'm asking for the federal government, especially, that we should have a draft long-term plan on how can we effectively, um, you know, address this virus, and also figure out a way on what is the possibility of how we can counter a future virus. I mean, there's just so much that comes along with it. I will give you one recommendation. Since the defense industry is so involved in the coronavirus pandemic, I would say, looking at the National Defense Authorization Act, which is money that is allocated for the defense spending each year. From now on, we should make sure we have enough pot of money to ensure that we are ready, prepared, equipped to respond to a health security crisis like the pandemic that we're seeing right now. Unfortunately, that was taken for granted this year, and we did not have the resources in place to rapidly respond to this crisis. So, moving forward, when it comes to the NDAA, the National Defense Authorization Act, we need to make sure that there's enough money in place to respond to the coronavirus. Unfortunately, there was really bad guidance provided by the executive office as far as responding to a health security crisis. There's a lot of speculation coming out that it was disregarded. Uh, that the health advisor sitting on the National Security Council didn't necessarily have a voice. There were some National Security Council members who have brought to the attention to the senior leadership saying, hey, this is something we need to respond to, but it was ignored. We cannot operate like that. And because if it was not ignored and in fact it was taken seriously, we would have more resources, more money, more things in place to make sure that we were well equipped to respond to this virus. So I'm telling you, everyone, we got it. We got to do business differently. We have to be more polished, and we have to really take these things into account. And then we also have to make sure when we look into global threats, right? When we look into global threats that impact our national security, when I say national security, I'm talking about it affects everyone. We have to make sure that we know what these threats look like. Threats are not just military aggression. Threats are also impacts from climate changes, as well as financial instability, as well as a spread of a virus. So we have to really think, unique here as far as how does a global threat, how do these 21st century global threats impact us at home, and how can we collectively respond to those global threats? So we're in the 21st century. Things are different, and we have to really ask our elected officials what does this look like in terms of our security environment, and how can we be fully prepared to respond to 21st century global threats? So I end on that note as far as talking about global security and our stimulus packages that we're seeing coming out of the state as well as federal government, and we'll open up to now the Q&A. So what questions do we have out there? Let's see. Oh, thank you, Rosa. Beautiful words. Thank you. More questions? Oh, okay. I do have one question. Um, what can we do to better help um, the correctional uh, officer services or faculty services? Um, right about now, you're seeing where, unfortunately, the law enforcement or the jail system is overwhelmed. And it's a frightening situation right now where there's a lot of speculation that you're seeing in the news where there's not enough PPE. We have correctional officers that are overwhelmed. A lot of them have been impacted. This was all over Channel 12 yesterday. And first and foremost, I want to tell you thank you for your service, for being out there to help, protect your community and work through this crisis. But another thing, too, is that, again, this is another indicator that most of us weren't really prepared for a virus like this. And then when you look at a unique environment like a jail system, we have to make sure that when it comes to who is bringing in the virus, what's going on, how many people have been impacted, how many people in there are going to get tested. We have to make sure that they have a plan in place to know how to respond to those type of situations, because it is a unique environment where you're dealing with an isolated area, and if the virus comes in to those type of systems, it would definitely overwhelm the people that are in there, whether it's people that are in jail right now or correctional officers. But again, the system, it needs more guidance, and I think they're now experiencing a hard lesson on how to address the coronavirus. So I wish them well, but this is definitely unfortunate. Any more questions? Okay. Oh, I do have one question about uh, the international community, how they should be responding to the coronavirus. Uh, my mother actually brought up a really good point not too long ago. She said, how come you're not really seeing the international community coming together, providing information how they are aggressively looking for a vaccine? What are some of the policy solutions that they're recommending to the people? Building some sort of community guidance, or trying to bring some sort of confidence in the system. Where are we going with this? And that is true. And that's why I call on for a global task force where we bring the international community together to figure out how can we effectively counter this pandemic. In fact, I just saw recently that was pretty disturbing that the Cubans, which has Cuba has a really good health care system, they actually went to Italy to set up or help provide resources and recommendations to the Italians, and they did not come to the United States. And of course we know why. We have a somewhat close relationship with them. Our relationship is not so good, but that was definitely an indicator that we're not necessarily all together working together on the global stage as far as how can we effectively um, counter this pandemic. We are seeing some good signs coming from South Korea, I think Italy too, and other places where they're providing recommendations to the United States on how can we effectively move forward. But I will call on the international community to come together to think of some solutions solutions that can help fight against this virus. Of course, that's probably happening at the United Nations. Again, I want to see more at the World Health Organization. And guess what? As your congressional representative, you have a voice to do that. Most people don't know this, but Nita Lowey, who I will replace, or I will come after, I will be her successor. She actually did a lot of work at the United Nations, and spoke about issues involving global issues like the coronavirus. So when you think about a federal seat, especially when it comes to Congress, there's a lot of relationships or work involving the international stage, especially when it comes to the United Nations. So if I was your elected official, I would definitely reach out to United Nations, World Health Organizations, and other relevant international institutions to set up some sort of global task force to help expedite some recommendations or some guidance here to the world. How can we fight this pandemic? So that's an excellent question. Okay, more. Okay, here he says, I used to work 5 days a week because of the coronavirus. Now I am working 2 days a week. Am I qualified for unemployment? I would say yes, but you definitely have to look up the information to find out. And in fact, you could contact Asha for Congress, and we can find out and look for you to see if you are qualified. But my recommendation will most likely be yes, but you have to definitely look up and read the information to see if you are qualified for unemployment. And that's actually an excellent point, because I would tell you about 2 days ago, it was reported that 6.6 million Americans have filed for unemployment. 6.6 million. We are in some hard times right now. And and if that trend continues, uh, we have to make sure that have we reach some sort of financial stability, because that's indicator of destabilization when it comes to economic stability. But like I said before, there's some good signs here where the federal government and state are issuing unemployment benefits. So again, I encourage you to look up the information. Okay, Dora Turner, I'm so proud of the work that you are doing. I ran into a woman in Walmart this morning, and she is a nurse. she has been unable to get her own supplies, such as toilet paper. Oh, yes, I understand about the toilet paper situation because she has been at work. What can we do to make sure that our essential workers are able to obtain the supplies that they need for their own personal use? Okay, so for the that's an excellent question, Dora, and how I hope you're doing well. I miss you, by the way. For the most part, when it comes to supplies, I think what everybody's doing immediately is making sure that they arrive at the supermarkets or the stores really early because they usually stock up overnight, and you're able to get the supplies right away. When it comes to PPE or ventilators, like what we talked about earlier. This is why I have called for again and again and again that the executive office needs to continuously ensure that we have the necessary resources to fight against the coronavirus. Also, I would tell you too, when it comes to additional supplies and food security, we have some really amazing nonprofits, organizations, or just local groups coming together to gather to call on for people to come and donate, and they're out there providing the necessary resources that people need. So if on social media, and in fact, we'll keep continuously updating our website to make sure that you know where to go to look up those groups. But there's a lot of them right now that are very active as far as making sure that if you don't have enough money to buy food, they're there to donate the food. And it's just a lot of information. I would encourage you to do that. But going back to the store issue, definitely make sure you get there early before the before the food supply runs out. Uh, Toilet tissue is. I'm going to just say something real quick about toilet tissue. It's kind of nervous. It's a sign of nervousness, I would tell you, and I would also recommend, please don't over purchase the toilet tissue. We really need to make sure that everybody has toilet tissue. But if if we have too many people purchasing a lot of toilet tissue, you're going to have a scarcity of toilet tissue, and we can't have that right now. So please be mindful of that for sure. More comments. Okay. Can you tell us about how campaigning has changed for you and others in our country in the midst of the pandemic? Thank you, Jonathan. Okay. How has this changed me? Well, I will tell you that when I first joined the race, I was the first one and the only one that told everyone in this district that we need someone strong on national security. Why did I say that? Because of my military experiences, because of my academic experiences, that I learned about global threats, and I knew that global threats are always going to continue throughout our lives, and that we have to make sure that we are fully prepared, especially the government, to respond to these global threats. And based on my experiences serving as a deployed soldier in the Middle East, I learned a lot about global threats, and I wanted to take my expertise and continue to serve my community as an elected official. So that's one of the reasons why I decided I wanted to run. Well, how has this changed me? Well, I would tell you, throughout the process, I talked about it all the time. Some people said, hey, you're right. We should move on with someone that is really strong on national security. Others might have just ignored what I said. Now that we are 4 months or 4 months later since I've joined the race, we're seeing a national security crisis unfold. And how has that impacted me? Well, I will tell you, I have been telling you this, and now it's being played out. And it's also telling you more that we need somebody that understands and knows how to execute crisis management. And that's exactly what I did overseas. Now, if you look at my opponents, nothing that this is not about to, I'm not all about politicizing this conversation, but I want to be very, very, very candid with you. Most of them don't have crisis management experiences, and most of them did not bring up about national security. But I think that's pretty cheap when you talk about this position, because on a federal level, you have to understand national security. I'll give you one example. I talked about my military experiences. And military experiences are very important when you look at the federal level, because when you look at our budget, more than 60 or 70% of our budget goes towards the military. So it makes sense to have someone that represents our community, not only understand domestic policy, but understands national security, especially the role in the military. I've mentioned that several times since I've joined. Now, what are you seeing? You're seeing not only the National Guard running around in New Rochelle, but also they're demanding for the National Guard to come into Rockland County. You're seeing the USUN come up here, the naval ship come here and drop off beds, as well as additional resources to help with supplies. And then also you're seeing right down the street in my house, the Army Corps of Engineers building up a hospital site. There's military examples running around all over here. And it's being used as one of the number one factors that we need to resolve or counter this pandemic. So when someone is trying to tell you something, please take it to account, especially when it comes to a congressional seat that involves crisis management experiences, national security experiences. And if you don't like that, I don't know what to tell you. You just got to read about the seat. But that is the truth. So I would tell you, not only I have been proven right, but I have also been quite disappointed the amount of people that have disregarded what I have been saying in terms of national security. And now it's being played out. So when you look at the campaigns, we can't even campaign barely. We're limited because of the fact that we can't go outside. We all have to be quarantined. This is unique in American history. I can't even go to a fellow elected official and say, hey, have you done this before? And give advice, because they're like, I don't know what, I've never done this before. I never conducted a campaign during a pandemic. The closest example we have is probably maybe like the financial crisis or 9/11. But again, we have to take national security serious. It affects everyone. We have to get out of that mindset that, hey, I'm black, you're white, you're a woman, I'm a man. I have my own thing, you have my own thing. Look, I understand that everybody has their own problems, but we are all American, and we have to all live up in this country together. And when a threat comes in, we have to all work together. We saw that in 9/11. After 9/11 happened, all of us came together to fight against that threat. We have to do the same thing. And when it comes to a federal position, especially in Congress, you have to have that mindset. You have to know how to manage these national security issues. So that's a great question. And Dora, thank you for saying thank you for your service. Any more questions? Okay, so thank you so much for joining me today. I really enjoyed the conversation. But again, the questions do not stop here. If you have any questions, please visit us at www.ashaforcongress.com. Also, please donate. I know that's a hard question to ask right now, especially when we're going through financial instability. But as you can see, because of this national security crisis, because the working class is going through so much, we need someone like me in Congress to represent our community. I am the only candidate that's most in touch when it comes to our issues when it involves the working class, and I'm the strongest in national security. That is a compliment. That is something that goes, by all means, something we definitely need in Congress. Also, too, please visit our coronavirus updates. We will be constantly updating our information on our website. I will tell you right now, unfortunately, because we live in the age of information, the information age, excuse me, there's a lot of disinformation going on out there, and we are there to make sure that we provide credible links for you to read about how we can effectively address the coronavirus. So again, you can visit our website. and send your questions in. Reach out to us. We will be meeting again for afternoons for Asha next Saturday at 3 p.m. And also throughout the week, I will be providing some remarks about different topics. My next one will be about money, politics, and the coronavirus. So please definitely stay tuned for that. But again, thank you so much for your time. Have a nice day and stay healthy and stay safe.